Then put on ventilator. Okay. Though this is the sequences. She was intubated in the morning, and then if you see her ABG, the PCO was 57 and PO2 of 57. So the PF ratio was less than 60, and in spite of being on ventilator, her saturation is just improved up to 75. Okay, they have been given, she has been given a prone position, but again there was not much improvement in prone position, so she was being considered for a ECMO. Okay, so ECMO was initiated. Okay, so the team had come and initiated ECMO with a jugular-femoral route. Okay, 29 French femoral cannula and 21 French jugular cannula was inserted. And after initiation of ECMO, she stabilized. PO2 was 84, PCO of 40.7. You can see the hemodynamic parameters are stable, and this was an X-ray before going for it. Now this patient is stable. The hospital does not have an ECMO facility, so the ECMO was initiated by your colleagues, and now you have to shift this patient to your place. Okay, so you have to transport this patient to your place. So whatever you think need, you can ask. The staff will provide you everything. You have to take this patient to your hospital.
Basically, this is a case of EV ECMO initiated, and first before the thing we'll form a group, and we'll take a lead. He is taking the lead, and one person will be taking the first consent from the parents, and the other hospital will take the consent and making a green line. Then we'll start the moving for the patient for here.
Before that, we'll
get a portable ventilator.
Yeah, give them portable ventilator.
Extra battery backup.
Portable ventilators.
We'll check the extra battery.
and sheets.
Let's check everything. Markings. Can anyone have pen for keeping the markings? For lines.
Keep two people up there at the neck and tube the lines.
Yes.
The bamboo. Yeah. Two people up.
Before that, we'll have to
people
put
down
sheets
this
underneath
Yes.
to transfer the patient to the other side.
Not now. Just we'll
Sheets
keep
first.
everything arranged, and then we'll shift. Okay.
Okay. Check the urine bag. Everything is done.
Disconnected from there.
CVP line. Everything is fine. Okay.
Vinyl sheets, bed sheets.
Can we use this sheet?
They'll give another.
No, underneath one sheet.
Keep your mic on.
Yes. Okay. Before shifting, do the suction. Someone do the suction.
Suction done.
Transport ventilator. वहाँ पे या फिर
We'll use this
bamboo.
like an under sheet.
We need a vinyl sheet.
It's okay.
इसके ऊपर
Use
ट्रांसफर करने के
this
लिए.
gum. Underneath metal color sheet. You have to take this in this shape.
We'll use this bracket.
Okay.
Not like that. Roll करके रोल करके
The,
Okay, put it this way.
एक मिनट ऊपर
Lines.
yeah,
Yes,
One
yes,
for
yes,
right
yes, yes.
lines.
it's all right.
Okay.
Yes.
Yes. I will
On
secure the
count
line.
of 3, we will turn the patient to one side.
30 degrees. Okay.
Okay.
Yes.
push it little more inside from the upper end. Yes.
Okay. Yeah.
Done.
Just
Yeah.
wait.
Yeah.
Back to the normal. It's fine.
Okay.
We'll lift this side.
Or cut
Count.
the tube.
1, 2, 3.
Cannulas.
Someone should.
Please secure the cannulas.
Yes. Got it.
Yes. Okay.
Now again, look for the vitals. Color change.
Yeah. Everything is fine.
Vitals are stable.
Tubes and cannula are aligned already.
And we'll have to put the monitor.
I have to
Are the tubes
put
okay?
it here.
Not
So
getting
now
kinked
it's
over
not
there.
in-
No, tubes are fine.
Yeah.
We'll
Not
put this
kinking.
also. We'll put this also.
Oh, you're not like it.
Yes.
Oh, it was here. Let's repeat.
Okay.
Let's do it again.
No, not like that. Roll.
Wait,
roll.
wait, 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 wait.
This
No.
one, this.
So we have to put it under this.
Yeah.
Under.
Correct.
Under. Yep. And I'll fix the tube and the line.
Yes.
Okay,
One.
1,
Cannulas are secured.
3.
3.
That's okay.
Okay.
Please secure this cannula.
Oops.
Yes.
Okay.
Yeah.
Check the extra battery.
Before
Ventilator.
we will cover, we have to put everything.
Give them ventilator.
Ventilator, monitor.
Ventilator, monitor, oxygen.
Extra battery for the Ecmo.
That's there in the machine.
Yeah, okay.
Meanwhile, we can increase the FiO2 of the ventilator to 100%.
So we're increasing FA to 100%. Oxygen backup, 2 cylinders. We need 2 oxygen.
Yeah, cylinder is ready here. Somewhere.
One for the ventilator and one for the ECMO. So,
I think we might have to
Okay.
get the bed little down.
Go.
on battery back. Power got
Yes.
disconnected. Power got disconnected. Oxygen cylinders.
Okay, what is it
Cylinder
here?
is
So
delivering some
it
volume.
delivers something. But
Yes.
We need 2
what is
supplies.
here to here? We don't have to add.
Connect to the oxygen.
Yeah.
ತಿರುಗಟ್ಲೆ.
Here is everything. Alright, alright.
Okay.
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 Oxygen on here.
Oxygen.
Oxygen. One more.
No, for ECMO we need 1 more cylinder.
One more. We have that. Right?
Let it be on that side. उस तरफ जाने दो उसको.
Maybe it's better to put it after the cover and then cover and
You take the
roll it
bed
like
little
a
down
banana.
Yes.
so that lifting will be easy.
Wait.
And we raise the.
And put
नीचे
it
जाओ क्या
down
थोड़ा?
and then after
इस
we will
bed को
have
open करेंगे?
everything alright, we will cover it and
Yeah, yeah.
roll it.
We'll put it here. This
ये
one
नहीं नहीं
ventilator.
ये इसका height ऊपर करना पड़ेगा.
We will
Where should we put the ECMO?
we can carry that like that. 3 persons should go that side.
One person secure the cannula over there. Head.
And the
We'll
tube.
handle it here and
Bed थोड़ा नीचे.
there.
Yeah.
Shall I stay here?
No, okay.
Okay, hold the tube like this.
Tube.
Okay. I will
Tube.
fix head, neck and
Someone
Neckline.
hold the cannula here.
one has to hold both.
Is everything ready in the downstairs? Ambulance?
Okay, on a count of 3, we will move the patient to the other side, onto the stretcher.
The hospital has been informed, patient is being shifted.
Yes. Make in green channel.
Patient is desaturating.
No, let's do it quickly,
we shift it.
otherwise. Okay, let's move the patient on the stretcher. 88 should be okay.
Okay.
Let's check the kinking.
No kinking.
Okay, lift.
One,
Count of 3.
1, 2, 3.
hold this, this is for this, the ventilator.
Yes. Ventilator.
Look at the
Check the saturations.
Vitals okay, saturation okay, tubing.
Cannulas are secured.
Yes.
okay.
There's the monitor.
The tube is okay, catheter is okay. Want to go for
Put it down.
There's the monitor.
this is not
Pulse oximeter.
yes.
Monitor.
Flow is decreasing somewhere. No, chattering. Not chattering. Check the lines. Venous line.
No,
Yes.
venous line is okay.
Is there any
Maybe-
kink?
Maybe
No kinking.
no kinking.
What's-
Maybe we can give some
BP has increased.
volume,
Give fluid
give some
bolus.
sedation to the patient.
What do you want to give?
So we'll
Fluid.
give some volume
How much
and
do
some
you want to give?
we can give 500 ml and we can give some sedation to the patient.
Now it's stable.
Sedation and paralysis. Paralysis and
You want to give sedation and fluids. Okay, fine.
Fluid bolus.
Fine. Anything else you want to do?
will paralyze the patient.
Fine.
Like that.
Okay, so you reach the destination hospital, shift the patient back to the.
Okay.
Okay.
Okay, let's move the patient. Back on the bed.
You
Same
be this head and
positions.
hold the cannula. Okay, I'll hold it.
Here. Like that. Stay here.
You can come.
Lock the pit.
Okay, first we will connect this to the ventilator. Tubings.
Wait, before.
Upper sheet once. We will connect this to the ventilator.
Huh?
The tubings to the ventilator first.
Oh, okay. Maybe it's been
No, first little shift,
ready. Yeah.
then we can connect.
No, first we'll connect and then we'll shift.
I can first. FIO 200.
Short. It's too short.
That's it.
We'll shift. We'll shift after connecting here, and then we'll connect to the ventilator once we shift. Okay.
Okay. Secure the
Secure the
cannula.
cannulas.
Yes.
Tubings also.
It's all right.
Yes. No kinking of the cannulas.
Yes, I'm holding. Yeah.
Now connect the
Cannulas are
ventilator.
secure.
Keep FIO to 100%.
Stand here flat, please.
Connect this nature.
Maybe flat is a bed. How hot?
Yeah. ठीक है.
Okay, now they will do it. Rest of the things. Fine.
For the count of 3. 1,
2, 3.
keep it, roll it back. Roll. One,
2.
Wait.
Already?
Ready? 1, 2, 3.
Yes.
Okay, fine. So, did you have any problems while transporting this patient?
Bit of desaturation and noise, chattering sounds we heard.
This is chattering,
Chattering.
Yes.
desaturation. What else? What else you have observed?
Hypertension, BP
There was
process.
hypertension, chattering, and
Tachycardia.
desaturation, tachycardia. Okay. Anything else you observed?
This decrease in the flow rates.
But that is probably because chattering, isn't it?
Yes.
So we included chattering part. Okay. So fine. Now just thinking back of whatever you have done, okay. Can you think you can next time when you can do something better, or you want to add something, whatever you might have missed out something?
it's better to place, before replacement, to place Ecmo on patient's hips, or for example something like that, and to replace her with the whole cannula, the whole circuit on her, not to disturb the position of cannulas.
Okay.
We could have given sedation prior
Yes.
Before
shifting the
shifting.
patient,
Yes, that
sedated
is.
and paralyzed maybe.
You could have avoided
Yes.
hypertensive response and desaturation, isn't it?
Yes.
The desaturation because of increased cardiac output. The moment everything is settled down, the saturation, everything has come up, isn't it? So sedation could have been given before shifting the patient. So you have to see that the patient is adequately sedated. Okay, number one. Number two. Yes. What else you think you could have done better? Once you tell, then I'll tell you what are things you left out.
To give more sedation.
Yeah, sedation is said. Then
Maybe we could have given extra volume before shifting.
extra volume may not be required, but then you have to keep volume ready for
Ready.
that, because when you shift the patient, when the chattering occurred, before shifting, after shifting.
After shifting.
So that is the time where when you shift the patient from bed to trolley, and from trolley to bed, this is the time the fluid shift takes place. And because of this fluid shift, you might get volume issues and you get a chattering and that. So this is typically seen at that time. So you have to be ready to give fluid. So fluid has to be ready for giving it fast. Okay, fine. Then
A bolus dose of heparin before shifting.
no, again that's dicey. May not require to give bolus dose of heparin. You can continue with heparin infusion if required, and or we can take the patient to ambulance and you can start heparin infusion. So that is okay, fine. That
When
few
you were
minutes
given
not
the
going to make
task of transporting this patient,
But-
what were your initial thoughts? Did you think about any organization, or all of you went for the same purpose? Somebody looking after the ventilator case, somebody after the cannula,
Yes, sir.
and rest of the
It was
mechanism.
decided
Role,
that,
role allocation.
yeah.
Did you organize?
Yes, she was going to look after the ventilator and the cannulas on this side. These two were going to look after the ECMO and everything. We were removing the
Foley's.
Foley's, as well as raising the, so two were at the feet and two were at the head, and two were at the ECMO machine side, sir.
Okay.
The few things you want to say, add still something, or should I say what you have missed.
Six.
See, number one, you didn't ask me how far is the hospital.
Okay.
Okay.
Mode of transport.
Mode of transport.
Mode of
Air ambulance or by road.
Isn't it? That's very important. So, second, evaluation of the patient. I said transport this patient, but whether the patient is fit enough to be transported. Okay. You didn't ask me how was the cannulation. This patient has just been cannulated and taken. Okay. Now this patient has got a multiple puncture while cannulation. If you get a big hematoma on the cannulation sides, okay, or patient had an hypotension during cannulation. So all again that entire trend is very important. Don't just go look at the parameters and do immediately. Don't react. Okay, find out how was the cannulation, was the cannulation stable. So number one is whether patient is fit enough to be shifted immediately or no. That's the one thing. Okay. Now what is your main concern is here is retroperitoneal hematoma because the patient is just cannulated. So your chattering, yes, most of the time it is just fluid shift and your chattering was there, but if they continuously persist chattering, then probably it might be a retroperitoneal hematoma. Okay. Second, you didn't ask me about the parameters like how much hemoglobin, how much is platelets, whether you want to carry the blood along with you or no. Okay. Yes. Distance is important whether to decide how much oxygen will require to take. If I say that your hospital is 600 kilometers away, your entire thinking process is going to change, isn't it? So always first evaluate patient, how far you want to go. The second hospital, the hospital is ready. So you have to evaluate all that particular points. Oxygen calculation, that is very important. How much oxygen you need to carry. Okay. So that is very important. Okay. That is number one. Number two is you said about the sedation, you said about the fluid, okay, that you have observed. These are the common thing that is going to happen, okay. But the one which is uncommon and dreaded is your disconnection. Did you check the tube length, whether tube length is sufficient, okay. You have to check all connections, whether they are properly fit. You have to look at the cannula sites. So first is the thorough examination of the patient you need to do. So you have divided yourself in three teams. They were looking after Ecmo parameters. They should have asked me questions related to Ecmo parameters. Now flow is okay, but whether he was getting chattering, did he give any problems during the from cannulation till now about the flow issues, whether there was any flow issues or not there. That is the thing. The one who is looking after ventilator, they should have asked about the ventilatory parameters. Okay, whether patient had a pneumothorax or no, or what. Have you done the X-ray after the procedure? Okay, just to see the cannula position. Okay, the cannula are too close to each other. You may not be getting chattering now, but you might get you may not get recirculation now, but during shifting might get recirculation, isn't it? So you have to always look all that. See, you are right now in a safe zone. You are moving from safe zone to unsafe zone. Your ambulance is not going to be as safe as what your ICU is, isn't it? Yes. So you are moving from safe to unsafe zone. So you have to always look into all these parameters when you are moving from safe to unsafe zone. Okay. The one who is examining the patient should see head to toe, should look at the circuit, everything is fine. Then only you take a call. Yes, now we can think of taking this patient to shifting. So for all this, what you require is your checklist. Okay. Okay, these are the parameters we have already checked. This is fine. Suppose patient had a hematoma or patient has hemoglobin is low, your transport distance is more, you might think of carrying some 1 or 2 units of blood along with you. Okay, that is just for precaution so that you can, if there is required, you can give some blood. Okay, so that is all things that needs to be done. If your hemoglobin is good, more than 10, I don't say you take blood in all the patients. If your distance of transport is only say 10 kilometers, 20 kilometers, I don't say you carry the blood. But if the distance of transport is long, hemoglobin is low, you are getting, there is some history of bleeding, then that better that you take the blood along with you. Okay. So these are all small points that you need to keep in mind. Because see, battery backup and oxygen, these are the two things which is very essential. Now, what are the things you missed? Did you carry hand crank in your hand? That is very important. You cannot move the patient without hand crank.
Hand crank.
If suppose hand crank is not there, you can refuse, I will not transport this patient without hand crank. Okay. Did you carry clamp in your hand? The team leader should always have a clamp in their hand. Suppose some disconnection occurs. You have seen yesterday.
Yes.
I had a
Isn't it?
clamp here.
Yeah, you had a clamp here, but especially in your hand, okay, so that whenever if there is something goes wrong, you can immediately put the clamp. So that is very important. Clamp and hand crank. See, other than your ICU, you carry ventilator, you carry all emergency drugs. That is all equal. Okay. Other than your ICU, what is you required to is two things: hand crank and clamps. Without these two, you are not going to move. Third thing, which is enough fluids, because we are likely to expect to get some kind of flow issues. So you might have to give enough fluids. So these are the common things. So hypertensive, tachycardia, desaturation, and
Disconnection.
not disconnection, and the fluid flow issues. These are the common thing that happens. Disconnection is rare. We talk a lot about disconnection. Okay. But this is rare. This is dreaded. That's why we talk more about it. That is not common. Okay. Your cannula site bleeding is common. When you shift immediately after cannulation, when you are moving the patient, you might flex the limb and that. So cannula site bleeding is a concern. Okay. So this is all important points that you have to remember. Okay. Fine. Any questions you have now?
Just a few bits from my side. ICU is the most stable place where the patient is, so he should be fit enough for transport. During the transport, it could be short transport or long transport. If you come across problems, it will be difficult for you to settle them en route, even if you find out over there. And definitely patient has to be sedated before proceeding on the transport. You murmured about paralysis as well, but always make sure the patient is adequately sedated before you give paralysis. Nobody should be awake underneath the paralysis. That is the main issue. I don't mind if you slightly over sedate also, but you shouldn't be under sedating before giving the paralysis. Any questions from your side?
Any questions, Kapil, from downstairs?
Questions, please? No, sir.
Okay, fine. If there are no questions, then I have one question for all. First, with this team, if they don't have answer, then it will go to the audience downstairs. Okay. Now, suppose you are transporting this patient. You are in air ambulance. In mid of the air, your oxygen get exhausted. So you don't have any oxygen supply. Your sweep gas is come to zero. What will you do?
Please, Ambu. At least.
Ambu?
At least Ambu.
You can move the ventilator, isn't it? What will happen with oxygen? ECMO.
ECMO also
Sure.
to the
To this gas line also will
gas
connect
line, you can
ambu bag.
connect ambu bag and then back the patient.
Connect move back to the gas line. How will you do that? It means all of you read the book and came. How will you do that? Anybody knows?
Connectors.
We will take a connector and move.
Then from where you read this? Connect the move back to the connect the move back to the gas. Okay. So rather than umbuing the ventilator, okay, lungs, better to umbu the
ECMO machine.
ECMO oxygenator. Okay. The reason is you are at least giving air, so at least the CO2 was out will be there and 21% FiO2 will go. Okay, rather than nothing is going to there. Anyway, lung is not going to contribute lot, but probably that will contribute. Fine. And it's connected usually with the connector like this. I think that I have given the picture in the
Somewhere we saw.
you have seen that. Oh, fine. Thank you.
Can we use the oxygen from the helicopter? Can they
Yeah.
let us do?
Yeah, that can also be used. Okay. Anything else?
Will there be any pressure changes, sir, in air?
Yeah, definitely. See, whenever you are going to the air, okay. The one thing is that as far as ECMO is concerned, there may not be much of a problems. Okay. Only thing is the patient has even small pneumothorax. Okay. The pneumothorax can expand. Okay. So in that case, suppose as ambulance has to be transferred, you have to keep the ICD inside. Without ICD, you cannot go. Number one. Number two, there are a lot of regulatory issues like You can take only limited number of equipments, only limited weight that you have to carry. So that all things that needs to be carried. Okay. So usually you cannot, if suppose you have a long distance transport, you cannot take your regular oxygenator because that are very heavy. Okay. So to decrease the weight, what they have aluminum oxygenators cylinders. So that are lightweight cylinders. So they usually carry that. Okay. Third is most of the patients, they develop some hypertensive response while taking off and landing. Okay, that is because of accelerating and decelerating force. Okay, so because of that they can develop some hypertensive response during that time and they can desaturate. So these are the problems that can come up. And you have to see to it that your oxygenator is just below your pump. Okay, or at the height of pump, should not be above the pump. It doesn't make much of a difference, but if your pump stops, okay, and your this sweep gas and everything is going on, okay, it might cause some air coming in the oxygenator. So that you have to keep in mind. Okay. So one point you learn from this scenario.
Transportation takes care, and we have to be patient and common.
Okay.
Adequate sedation and muscle relaxant before shifting the patient.
Yes, adequate sedation must be before shifting. Yes.
Checklist before and to check everything before even touching and moving the patient.
Yes, very important.
When suddenly oxygen stops, we should connect to the Ecmo and AMBU.
Yeah, if there is no oxygen, better to this.
Instead of doing the ET tube, we should do the.
Yes.
And checklist.
He said that. You have to say something else.
We should not be in a hurry to shift the patient.
Without
Yes.
knowing the history.
Especially the cannulated just sometime before. You should not be hurry, stabilize the patient. Look at all trends, how the trends is, then only shift.
Control and clamp cannules.
Yeah, keep the clamp in your head. That is very important.
Be ready for troubleshooting.
Yeah, be ready for troubleshooting because you can get some unexpected complications and unexpected delay also you can get. So you have to be ready for that. Fine. Thank you.
Thank you, sir.
Thank you, sir. Thank you so much.